I'm going to be talking about pediatric obstructive sleep apnea. How do I know if my child has obstructive sleep apnea? And if you're a doctor, how do you know if your pediatric patient has obstructive sleep apnea? I'm going to start by talking about 10 things that I have listed here that serve or can indicate that your child or your patient should get tested for obstructive sleep apnea. Before I go right into it, I'd like to introduce myself. My name is Dr. Anna Kute. I am a sleep medicine physician practicing in Indiana. And starting out, I would want to say that sleep apnea is divided into two. You have obstructive sleep apnea, you have essential sleep apnea. Today I'm going to talk about obstructive sleep apnea in children. Obstructive sleep apnea is mainly described as an obstruction in the upper airway that leads to lack of oxygen delivery to different body parts during sleep. Now, diving right into the pointers to think of or have your child see a sleep physician or get tested for sleep apnea. The number one thing is snoring. So, snoring is big on the list and is one main complaint that I get from parents, typically noticed by the siblings or by parents. And what I typically hear is that children, some of those children snore on most nights of the week. Now, this is not when they're having an upper respiratory infection or anything like that. Snoring during sleep can be a sign of obstructive sleep apnea. Number two, labored breathing. You walk into your child's room and you see that they're struggling to take a breath when they're sleeping, or it's as though they're having pauses in their breathing while sleeping. This should prompt you to think of having your child get tested for sleep apnea. Number three, morning headaches. So you get this complaint from older kids telling you that they're waking up with a headache. Not a very common symptom, but can happen. Number four, daytime sleepiness. You can also get this in older kids as from 5 years and above. Now, less than 5 years of age, we expect them to take naps. But if your child is over 5 years and is still taking naps during the day, still feeling exhausted, falling asleep during classes, or you're getting that report from your kid's teacher that they're just tired and sleepy during classwork, this is a sign of untreated or possible presence of sleep apnea. Number five, coughing, choking, gasping for air while sleeping. Very classic and very common in children. If this is happening, this might lead you to think of having your child tested for sleep apnea. Number six, mouth breathing. And this can be during the day, this can be at nighttime. So you would, if you observe your child breathing, you can tell what they're doing. You can tell if they're keeping their mouth open to try to get some breath. And typically we should all be breathing through our nose. But if your child is breathing through the nose, or you have that history from a parent as a pediatrician, you should think of having that child tested for obstructive sleep apnea. Number seven, frequent nighttime use of the restroom, or I would say bedwetting if that child is not yet potty trained. Now, this sometimes could be in a child who has initially achieved dryness and all of a sudden starts wetting the bed. Or could be from a child that has not yet achieved dryness and still continues to bedwet even after a certain age, typically as from 6 years and above. this is a pointer to at least think in that direction. Number 8, difficulty swallowing can happen in kids because of enlargement of the adenoids, which is a very common cause of airway obstruction that leads to sleep apnea in kids. Number 9, hyperactivity. So some kids are just very active, and you may have gotten this report from their class teachers, or as a parent, even if you're homeschooling and you find that your child is so hyperactive. And this leads me to the next item on the list, number 10, behavioral problems. These are indicators of possible presence of sleep apnea. Unfortunately, some children get diagnosed as having ADHD when in fact they should get tested for sleep apnea. So these are the 10 things that I listed for you to look out for in your kids or in your patients, your pediatric patients, that can prompt you to have them get tested for sleep apnea, or even refer them to a sleep medicine physician to evaluate for obstructive sleep apnea. Follow me for more talks on sleep, and like and share if you've learned a thing or two. Thank you.